mHealth means a lot of different things to a lot of different people. I mean, it can be everything from sensors that patients wear to mobile apps on your phone to telemedicine where, you're bringing care out to the remote environment. I think the issue is not finding an mHealth application or an mHealth product that's so key. The key is, how am I going to improve care and reduce cost? And if I can figure out a way to bring care closer to the patient, to improve the patient's interaction with care, engagement with the medical process, and improve the physician or the nurse or the other caregiver's ability to take care of that patient and reduce costs, that's where you got to be. I think the areas that have been most successful are the ones that combine a technology of some type with a human service or a human interaction as well. Because, we can all sort of either throw out the technology if we don't like it or put it in the drawer or whatever, but it's the human interaction. So if the technology is measuring my blood pressure and all it does is flash a light that says your blood pressure is too high, well, maybe I'll do something about it or maybe I won't. If you call me up and say to me, hey, your blood pressure is too high, did you forget to take your medicine? Or maybe you should not eat any salty foods for the next 2 days, I'm more likely to do it because you and I are going to have a relationship. And it's that relationship that you can build on. So I think that's where I would encourage people to focus, is those things where there's a human component as well. I think what would be most beneficial is focusing on the care of patients who are sick, typically with chronic diseases, that happens between the doctor's visit. What can we do? And there's a lot of different things, a lot of different chronic diseases, so it's not one answer, but generally speaking, what can we do to help patients take better care of themselves between the doctor's visits? Because most of what happens about our health happens between the doctor's visits, not in the doctor's office, right? And anything that engages the patient in that way makes them part of the process, so they don't feel like they're being imposed on, but they actually feel like they're playing a role, I think is going to be successful, because it'll meet the two things of improving quality and reducing cost at the same time. So providers are interested in these kinds of technologies if it helps them either be more efficient or take better care of their patients, or preferably both. If it's more work for them, they're going to be less interested. So for example, if the mHealth technology is dumping loads of data on the doctor's screen, whether it's his mobile device or his office computer or whatever, every day, he or she's going to be a little less interested in participating in it. On the other hand, if it's a smart device that flags for him those patients that may be going in the wrong direction, and he can get to them before they turn the corner, the bad corner, then he or she would be more interested. So it works like that. I think the other thing is that the providers need things that are easy for them to use. Very often people are focused on what's easy for the patient to do, and that's appropriate, and they kind of forget about, okay, how can I make it easy for the physician or the nurse to use this system? There's a lot of technology coming out that's sort of very focused on the provider in terms of mHealth, whether that's improved messaging or improved information or clinical decision support, the ability to be sitting at home at the dinner table and interact with my patient in some way. That stuff is really great, and I think there's going to be a lot of power in that. There's going to be resistance among a certain group of physicians who may be a little bit old or maybe a little bit less comfortable in doing that, but I think that over time, that is going to be the way that a lot of healthcare is going to get practiced. Again, I think the major advice I would have for really any company in healthcare, but particularly companies that are trying to kind of be at the cutting edge, be it mHealth or otherwise, is focus on real changes that improve quality and lower cost. Not the one, because you had one patient who did one thing and that was so great, but really get the data to show that you have a technology, or better yet, a solution, a technology and services and people that can actually change the curve, and where when it scales, it's really going to be meaningful.